Hi, What the Health Tech listeners. I'm your host this week, Hayley Levene. This is the podcast where we tackle some of the trending topics, ideas and best practice in health and social care. This week, we're speaking to Joanne Howard, Director of Nursing and Quality at Malling Health. Hi, Jo.
Hi, Hayley.
Outside of work, Joanne loves getting on her mountain bike and is lucky enough to live near lots of off-road tracks to ride through woodland and hills. That sounds really nice. She also keeps a variety of rescue chickens and ducks. I love ducks. They're so cute. Joanne's also in the process of renovating her forever home, and with 2 acres of the garden, and her aim is to be as self-sufficient as possible, so there's plenty to be kept busy with. So before we start, Joanne and I have actually known each other for quite a while now, and although in a formal setting she's known as Joanne, I know she prefers to be called Jo, so we'll use that then instead today, if that's okay.
That's great, Hayley. I was beginning to think I was talking to my mother there.
Getting in trouble already. Great. So first, could you just give our listeners just a quick overview about Malling Health and your role and kind of what you do there at the moment?
Of course. So Malling Health is a company that's been going since 2009, and we're commissioned by the NHS to operate GP practices, urgent care services and out of hours. And we do this across the country as far as Woolwich and then to Shrewsbury and Telford and everywhere else in between. So it's a very diverse mix of services in a diverse area spread, and obviously getting everyone together is really challenging because of the geographical spread of everybody. And my role in Malling is that I am the Director of Nursing and Quality for the whole group, which I consider to be a very privileged role. I love my job. It's every day is a school day. I learn something new every day. But also I have the unique opportunity of being able to speak to and communicate with people from all walks of life in lots of different settings on a daily basis. So my job as the Director of Nursing is, as it says, I'm responsible for nurses and allied health professionals. And we have a range of quite a multidisciplinary team with us. We have paramedics, nursing associates and healthcare assistants. And as well as the Director of Nursing, I'm also Director for Infection Prevention and Control and Health and Safety. I'm the nominated individual for the Care Quality Commission, the CQC. So obviously a big responsibility in making sure that all of our services remain compliant with the Health and Social Care Act.
Sounds like quite a big job then, but I'm glad you enjoy it. There's nothing better than enjoying your job and waking up and being excited, is there?
No, exactly. It keeps me busy, keeps me out of mischief, and and does allow me to get my uniform on every now and then and go and work in some of the practices, which is really nice.
Do you like doing that when you get the chance?
Oh yeah, I love it. As a nurse, it's I always wanted to progress to this level of Director of Nursing. That was my overall aim from when I first started. But I do miss the patient contact, so it is really nice to be able to put my uniform on and go back and spend some time with patients. Although I don't think the managers like me being there, but I do enjoy it.
You're nice though. I bet you don't make them nervous. You just have a laugh with them.
I do. Try to.
So obviously big team and lots of different kind of roles to communicate with, and I know that we want to focus on communication and the importance of that in this podcast today. So why do you think communication is so important, especially in a setting like yours?
Well, it all comes down for me to about patient safety, and poor communication can lead to healthcare errors. In lots of ways, we can give the wrong medication, the wrong dose, etc., and that can lead to quite significant errors and harm to the patient, but also the impact that can have on the caregiver. So as a healthcare professional, if you don't feel you've been communicated to properly and you've done something wrong for the patient that's caused harm, that can really knock your confidence, make you feel inadequate. And so it's really important for me around, collaborating with your colleagues, ensuring that information is accurately transmitted, but also that it's received and understood properly. And by doing that, it means that the patients are kept safe and the staff are kept safe in terms of the registration, but also in terms of the knock-on impact that it has around confidence.
Yeah, you mentioned kind of collaboration as part of communication there, and I know that you often get people say communication is about you talking to them and how well you communicate with them, but actually people tend to forget that communication isn't a one-way street, it's a two-way street, and that's the best way to be effective, I guess.
Yeah, definitely.
Yeah, it's communication isn't just about talking at someone, is it?
No, and in my role, what I try really hard to do is to keep people engaged and don't make people feel like communication is being done to them, but being done with them, so that you get their opinion, their thoughts, their suggestions, as well as it. It is a two-way street. But I think it's such an important part of everyday life, whether that's in your work role or in your personal life. And there's so many ways that we communicate these days, text messaging, WhatsApp, Teams meetings, email, all as well as the verbal and non-verbal communication. So getting it right is vital.
Yeah, you always see kind of in job profiles, or even when you talk about your own relationship, it's all about communication, and without that, kind of things fall apart, really. And a lot of people think that they're good at communication, don't they? They think, yeah, I can communicate, I'm really good at that. But how would you describe what's the most effective method of communication?
Yeah, I think you're dead right. When you look at CVs, for example, people always put excellent communicator, and then when you're interviewing, that communication is sometimes lost, and we'll talk a bit about the barriers later on. But having effective communication, really, it's more than just that exchange of information. It's not just about telling somebody and somebody understanding it. You have to really understand the intention behind it. So why is somebody communicating to you, and understanding the emotion that goes with that, having that message clearly conveyed to somebody. But also, I think to gain the full understanding of what's being said, is that you have to listen in a way that makes that person feel that they've been heard and that they've been understood. And so, those are those things that will, make an effective communication rather than communication that's totally ineffective.
Yeah, and you mentioned sort of the barriers there, and some of the misconceptions that you get, or misinterpretations, I guess, of a comms or a piece of comms. What do you think the barriers are, and kind of what are your thoughts?
Yeah, so like using the CV bit again as an example, people do always write, excellent communicator, and then at interview, that communication, you think, really? and one of the biggest things around that is around stress, because interviews are stressful, and that makes you lose your train of thought. You can't think quick enough because you're under that pressure. It's the emotion that sort of becomes out of control, if you like, that creates that barrier for you to be able to communicate effectively. And particularly in healthcare, when you're responding to medical emergencies, adrenaline's pumping, there's lots of people around, but at the end of it, you've got a patient whose life is there, and, people start to shout a bit, or lots of people communicating messages at the same time. So it's important to really keep the focus, because that lack of focus on the task in hand can lead to barriers or misinterpretation of communication. And also, like, inconsistent body language, somebody smiling and nodding and saying yes, but they've got their arms folded and they look pretty grumpy, is probably a different communication to what they're really feeling. Sometimes, people do say, don't they, that a face can tell 1,000 stories. You might be saying one thing, but your face is completely saying something different. And then there's that negative body language that's also can be a real barrier. Like I've said, the hands folded, the hands on hips, that kind of thing. It's a very communication's very complicated. We don't think it is. You and I can sit here and have this conversation, and we don't think nothing of it because we communicate quite regularly, we talk quite regularly, and we don't think anything of it. But actually, if you really thought about the complexities that go around that communication, not giving off the wrong messages and not giving off the wrong body language, trying not to create those barriers or misinterpreting anything around the communication that there is.
Yeah, you forget, don't you, that body language is actually so important when it comes to communication, and your facial expressions. I'm terrible for facial expressions. If I'm not happy with something, my face says it all, and I really try to make sure that it doesn't, and I just keep smiling.
And in the good old days before Teams and video and Zoom and things like that, we all used to just do phone calls, didn't we?
Yeah.
And you could sit on the phone and you could frown and you could, but now you're on Teams and you think, oh, I can't do that, because you can see yourself as well. What?
Yeah. It's true, it really is. It's difficult, isn't it, when you've got so much going on in your mind to remember what you're saying, how you're saying it, how your face looks, how your body looks. It's a lot to remember, and I can imagine being in a hospital setting, if you're talking to a patient, if you're talking to their family members, and it's a stressful situation, if you've got to give bad news or something like that, what would your advice be to someone in that situation that maybe isn't as confident, I guess?
Yeah, I think you're dead right. I think the way that we communicate to each other outside of being in front of a patient is completely different. And, communicating to patients, there's so many things that you have to remember, especially when you're talking about things about giving bad news. And it's really not just hearing what people are saying to you, but listening to what people are saying. There's a difference, isn't there, between just somebody hearing it and somebody actually listening to what's being said. And there's things that you can do, try not to interrupt people and make it look like you're interested in what, even if you're not, make it look like you are interested in what they're saying. Because sometimes when you're breaking bad news to patients, they'll hear certain things and they'll hear what they want to hear, but they don't hear the full story sometimes. And so as a clinician, it's repeating it, asking them, do you understand? Is there anything that you want to write down? Is there anything that we can, is there any information that we can give you to help you understand that better? It's all those little things that make a big difference to that patient when they've actually left your consulting room, to be able to ensure that they've really understood what's been said and that they've got further information to go away with. And I think always asking patients, is that clear? Do you understand? Is there anything else? Have you got any further questions? And giving them, time is a thing with everybody at the moment, isn't it? Everyone's in a rush. Clinicians only have a certain time with patients, but actually giving a patient the time to express themselves or time to ask further questions as they think about it is really, really important for that communication. And also it builds the rapport between the clinician and the patient as well. If they really believe that you're truly dedicated to them at that time, listening to them, hearing them, talking to them, explaining things, it makes a huge difference.
Yeah, especially with something like that where it is, even if it's not, awful news and it's just something that the patient might not want to hear. I think I struggle giving bad news not all the time, because I don't really give much bad news, but if I have to give bad news, I always do struggle, and I have to rehearse it in my head as to kind of how I'm going to say it. But then if that person responds in a way that maybe you've not rehearsed or you're not expecting, it's about also having the confidence to kind of go back, isn't it?
Yeah, definitely. And, just repeating yourself once more, just to make sure that, the patient might give off some body language that makes you think, actually, I don't think they've understood that, or, I'm not sure they've quite grasped that. So it's just repeating it again, and again, observing for their body language, observing for their facial language, just to see. It's all that non-verbal stuff that really can make you, as a clinician, think, I don't think they've quite grasped what I'm saying, and trying to maybe word it in a different way. And, clinicians are great at using jargon.
Yeah.
And, that can be another barrier or misinterpretation, not just between patient and clinician, but also between clinicians. If you're speaking to people in a language that people just, I don't even understand what you've said, it's quite difficult. And then, of course, there is, the obvious barrier can be, the language barrier, so making sure that, if you know somebody who's coming to see you that's first language isn't English, is around making sure that you've got the right interpretation services there, so that can be relayed in a language that they really understand, rather than a potted version of what you're trying to say. And we're really lucky these days with technology, and that we can get lots of information printed in so many different languages, which will really support and aid the patient going forward.
Yeah, definitely. There's a really nice quote that I think is really strong, which is, most people don't listen with the intent to understand, they listen with the intent to reply. And I think that's quite powerful when you think about how to communicate, especially in kind of situations that we've talked about. So what's your kind of advice on making sure that you remain engaged in what's being said and not constantly thinking about what you're going to say next?
It is a really powerful statement, that, and it is so true, isn't it? When somebody asks you a question, your immediate response is, I need to reply to that. My manager, who's the chief exec, is really good at saying to us, I'm going to ask you a question, but I don't want you to reply to me now. I want you to go away, I want you to think about it, and then come back to me in the next 24 hours. And then she asks a question. And that's really good, because, we don't know everything. And, to be able to answer it in an appropriate way that gives the right information that she's after might need some digging around, or some exploring, or some speaking to other people. So she's really good at doing that. And that's something I think that we're all sort of taking away, to say to people, when we're asking them things, don't reply straight away. Have a think about it and let me know what you think. And it is really good. But I think my advice about keeping people engaged about what's being said is, it is around being fully focused on the speaker. Listen to what they're saying, and they always say, everyone's got a good ear and a bad ear. Always use your right ear or your left ear, whichever one is your good ear, to listen to people with. And as I've said before, avoid interrupting. I mean, I have to admit, I am pretty bad at doing that, and I try really hard to keep quiet. Don't interrupt people when they're speaking to you, and try to. I think I always as well try to redirect the conversation. So if conversations go off, on a tangent somewhere else, it's try and redirect it to the message that you're trying to give. And I suppose one of the big things is trying to set aside judgment. We don't always agree with everybody, but it's, when somebody is coming to you with, I don't know, a really good suggestion about how they think it's a really good suggestion about how to improve things, don't judge them on what they're trying to do. Listen to them intently, and provide the feedback after that. And again, it comes down to the emotion, doesn't it? So, looking at those non-verbal signs and listening and hearing the emotion behind it, and I think being aware of individual differences. We're colleagues, we all work together collaboratively for the same aim, but with all the will in the world, you can't always get on with everybody. And so trying to put aside your little differences to achieve the right outcome is always quite important. And I think the things that we've said as well about the barriers to, to keeping people engaged is around, try to speak in quite an open and transparent way, rather than, putting barriers in front of you with your arms folded and stuff like that. And it is an art, keeping people engaged in what you're having to say or what is being said, it is quite an art. But I think, going back to your original statement, is that that people don't listen to understand what's being said. They are automatically starting to think about, well, how am I going to reply to this? And it goes back to the interview thing, doesn't it? When you're being asked a question, you think, I don't know the answer. And that's all that you can say in your head, rather than really trying to think about, okay, how am I going to get a response to this that is actually answering the question, or is actually giving them what they want to hear. And of course, there is absolutely no problem with anybody saying to you, I'm going to have to go away and think about that, or I really don't understand what you're saying. And I think that's that two-way communication again, is that when you don't know what's being said, ask them to repeat it, ask them to reframe it. It's that two-way conversation again. It's that, yeah.
Yeah, and it's okay to have a gap, and it's okay not to say anything. I think people are worried about awkward silences, aren't they? But actually, giving yourself that space to think something through before talking is fine. It's normal.
Absolutely. And there's that other old saying is silence is golden. Sometimes it is quite nice, isn't it, to just have that little bit of a breather to be able to compose yourself. It comes back to keeping your stress under control, making sure that you stay focused, and just having that little bit of breathing space sometimes is enough that's needed to make that communication better and more effective.
Yeah. I'm going to put you on the spot now. So, do you have any kind of examples, maybe in your early career, or just an example of kind of a communication that you've seen where you've thought that could have been better, or you've had to learn from it and really think about it?
I could give you so many examples of bad communication, but I'm going to try and focus on the positive. Okay. I think first of all, one of the things to say that in our company, in Mulling Health, is that I ran a staff survey. I'm going to say back in 2020, so it was just towards the end of the pandemic, and we did our annual staff survey, and we really weren't expecting any of the, we had no idea what to expect from the results because it had been such an awful year. But one of the things that we got back was that people didn't feel that they were communicated to enough. And it wasn't about the things to do with guidelines or policies or any of the really important thing. It was just people said they didn't really know who we were. And so I set about doing this Friday free-for-all. So every Friday morning, I send out an email to all the nurses and allied health professionals, and called this Friday free-for-all, where I just ask everyone how they're doing. I tell them a little bit about work, about what I've been doing that week. So whether it's been visiting practices, writing bids, or updating policies, or other things. And then I also give a bit about home. So what have I been doing at home? So, I've worked to clean out the pond, or have I been for a bike ride, or, cutting hedges or whatever. And when I first started doing that, I always put at the bottom, PS, reply to all, just to me, or not at all. The choice is actually yours. And at first, didn't get any responses. And then after about 3 or 4 weeks, started to get 1 or 2 responses just to me or to the whole group. And when we have a new nurse start, we always do an introduction to, so-and-so. And now I have to block out a Friday morning to be able to respond to people when they come back to me. So we get lots of questions and emails and conversations that start, and conversations go off onto a tangent. And inevitably, it is always about work. So that has proved to be a really effective way of just keeping that communication going between, a group of professionals. And it's been really successful. And if I don't do it, I get an email to say, where's the Friday free-for-all today? And I'm like, I'm on holiday. I totally forgot to tell you, well, here we go, So it's been quite a good, it's been quite a good, simple way of keeping that communication flow going. I can give you an example of poor communication. So when I started off my training as an enrolled nurse. So we were called pupil nurses when we were in our training phase. And as a young pupil nurse, I was doing a stint on paediatrics, and one of the nurses had said to me, "Oh, can you give that child in that room there that bottle of milk?" So, of course, I go into the room and there's a bottle of milk there, and I just feed this baby this bottle of milk. The baby drunk it, a little bit of wind, blah, 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 everything's fine. Nursey comes back and says, "Did you give it all the milk?" And I was like, "Yeah," because she said, "Give him a bottle of milk." She was like, "Yeah, but he only has so much." And I was like, "Well, I didn't know." And I felt really bad. I thought that I'd probably overfed this child. I was 20, I'd got no idea about kids. I didn't know whether I'd overfed it or anything. But, poor communication, really. She should have said, been more explicit. But equally, I should have said, "How much do you want me to give them? Is it the whole bottle? Is it half, or whatever?" So again, that learning process about it being a two-way thing. And I think from a good communication example, we had over the pandemic, we had a lot of patients that come into our GP surgeries who were refusing to wear face coverings. For whatever reason, they didn't believe in the pandemic and they weren't going to wear face coverings. But we had a lot of our nurses that felt really uncomfortable looking after these patients. Because they felt exposed, understandably. But obviously cannot refuse to give care to these patients. And so getting emails from people saying, "I'm not seeing this patient because they're not wearing a face mask," and being able to, I had to formulate a response to these people in a way that understood their concerns, understood their emotions behind it, and their anxieties and their fears about contracting COVID when they were doing their absolute best to try and keep people safe, but also trying to explain to them that, you've got a duty of care. You've got a duty of care to provide care to these patients. And so here are the things that you can do to protect yourself looking after a patient that won't wear a face mask. And that worked really well because people were coming back saying, "Thanks for the advice," rather than, "I'm still not seeing the patient." And I felt if I'd have just said, "You've got a duty of care, you need to see these patients," I'm sure they'd have come back and said, "Well, I'm not," So it was just understanding and having that bit of sympathy and a bit of empathy around it, to make them understand that, I hear you, I understand what you're going through, but you have got a duty of care, and these are the ways that you can protect yourselves further. And it can go one of two ways, can't it, sometimes? But I think if you take the time to just really understand what they're saying, they're not saying to you, I'm refusing to see the patient. There's more to it. And it comes back to that understanding the emotion, understanding the feelings. It was a highly emotive driven scenario in a time when everyone was really uncertain and unsure of what was going to happen if they were looking after a patient that wasn't wearing a face mask. So I think that was an example for me. That's a fairly good example of how to get a message across. You must do this, but explaining why fully and making sure that they've got alternative ways to keep themselves safe. There are different things that you can do around that, can't you? Yes, I had to assert myself in that situation as the director of nursing. I have to be able to tell staff that they've got this duty of care, but it's around recognising that there are other things at play here. It's not just somebody saying, "I'm not looking after that patient." There is a lot more onto it than that.
Yeah, it's definitely about getting that buy-in from whoever you're talking to, because otherwise, without buy-in, it's just not going to work, is it? We had a guest on a few weeks ago. He was the CEO of a company called Iatro, and they support practices with kind of communication and website communication and how they basically put messages out to the patients. And he was talking about how busy practices are, and we got into a conversation around kind of patients are unhappy about the fact that they're too busy. Practices are unhappy that patients don't understand they're too busy. And then it's just this massive circle of, "I'm too busy, but you're not helping me," and so on. But then no one's really communicating effectively and making people understand. It's like, how do you overcome that kind of issue?
Yeah, and we are in at the moment, it's an unprecedented situation at the moment in healthcare, because Secondary care is absolutely at crisis point. A&Es are overrun, hospitals are full of patients that can't be moved on. GP practices are seeing more patients now than they've ever seen, with more appointments than they've ever had, extended hours, and it's just there's nothing sort of moving at the moment. The demand has absolutely outweighed the capacity of healthcare, and it's a really challenging time. And for a patient at the end of it, when you just want to see somebody, you just want to get a solution to a problem that you've got, and being faced with these obstacles, it's really difficult. And yes, as professionals, healthcare professionals, we absolutely understand that, because let's not forget, at some point we are patients ourselves. But equally, the majority of patients do understand the pressures that people are on. But when you're unwell or you're frustrated, it's easy to lose that temper, isn't it? It comes back to that emotion, isn't it? It's that frustrated, that snappiness, that, complaining, and people take to social media to complain all the time about everything. Nobody comes to social media and say, oh, this is a brilliant service. It's, well, they do, but, it's more often that they take to the social media platforms to communicate negativities, which spreads like wildfire, doesn't it? It's a really powerful tool, social media. And I think, those words that need to be delivered have to be very well thought out. And it comes again to not just saying to people, we've got no appointments. It's about messaging right to make sure that the message is understood. It's to say, we've seen, for example, one of our practices says, today we have seen X number of patients face to face. We've done this many patients video calls. We've had this many telephone calls and this many home visits. And it sort of gives the message to say, we're not just sitting here twiddling our thumbs. We're actually working really hard, but we have no more capacity. But then it's giving the patient alternatives. I understand that you really need to see somebody, so here are the alternatives that you can go to. Your NHS 11, your urgent care centres, blah blah. And it's giving that message, isn't it? It's not just saying, we're full, doors are shut. It's about, we're full, doors are shut, but here's an alternative. So I think it's giving that message again. It's that two-way communication, isn't it, to make people understand that we're not just sitting here twiddling our thumbs doing nothing. We have been working really hard today, and it'll be the same tomorrow and the next day and the next day. But there are alternatives. It's a very difficult situation. You'll never, I think at the moment, the trying to get those messages across it's frustrating for every party. And sometimes you can say things and explain things in a really nice way, but sometimes it's not understood that way, and it will never be. And it can be quite frustrating and challenging for everyone involved.
I mean, the media doesn't help, does it, really? When you've got so much noise coming from the media about how this is going on and this is wrong and look at this hospital and this has happened, and it can be frustrating. How do you get rid of that noise and then put your noise there instead? It must be really challenging.
It is, and it's very sad. Some of the things that get reported are, it's a very, very sad place to be in. And I can't answer what about the press. We try very hard not to respond to things on social media, because we try and contact the person directly or ask them to contact us directly if they've made a specific comment about one of our services. Because we always feel that if you start getting into that social media, very public conversation, other people start joining into that conversation, and then the person that actually made the comment in the first place gets lost somewhere. So we try very hard to say, please contact us directly on this number, rather than engaging in that very, very public conversation, because it's not fair on the person that's made that comment. But equally, it makes it very difficult for us then to keep that focus and that drive on the thing that's been said in the first place.
Thanks again so much for joining us, Jo. I've learned a lot from today, and I'm really looking forward to talking to you again next week. So, next week, please join us again as we'll be back with Jo. Don't forget to rate and subscribe wherever you get your podcasts. And if you've got any questions for us, for our guests, for Jo, then please email whatthehealthtech@radarhealthcare.com. Thank you.